Welcome to the Intentional Health for Women podcast. I'm your host, Garrett GQ Query. This podcast is dedicated to developing intentional health for women. Former 400-pound fat man turned health and fitness professional, specializing in women's health. In this podcast, you will find over a decade of experience in the health and fitness industry, serving women to become their most intentional self through strength training, nutrition, and lifestyle practices. Each week, we will dive into a variety of different topics, ranging from interviews with women leading the way in the health and fitness industry, client case studies throughout the years, myth busting, social media trends, female hormones, gut health, and so much more. We are not normal. We are intentional. Welcome to another episode of the Intentional Health for Women podcast. Yeah. I'm your host, Garrett GQ Query, and I'm joined by Olivia Pompa, Dr. Olivia Pompa.
Thank you.
Of course. Welcome.
Thank you. I'm super excited to chat with you today. You obviously found me on Instagram, and it was cool just to have someone attracted to obviously what we're doing in the health space. And so thank you for having me.
I just think, it's the deeper I get into this stuff and, I talk to a little bit about my own personal journey. It's just continuing to dive deeper, continuing to help more people.
Yeah.
And
that's the mission.
It's what we need to do.
That is the mission. We just had our all company meeting today, and my father, on this meeting, we share testimonies just to inspire everyone within, the organization, because we are making a true difference. If we can teach clients to empower themselves, the real answer is out there. Ultimately, it's not a treatment plan. We're not giving them drugs. We're not giving them medicine that magically heals them overnight, right? Mm-hmm. What we're doing is we're teaching them the tools to ultimately empower their own healing bodies. God designed our bodies to heal once the interference was removed. And I actually am a chiropractor. So I went to chiropractic school. I refused to give my money to the medical system, even though I kind of wanted to go to medical school for the credibility, even though I knew I'd never practice in an in-person clinic. But what I love, my father was a chiropractor, Dr. Pompa, right? And he went to chiropractic school and he practiced for a short period of time, but God was calling him to something much larger. Yeah. And it was working one-on-one with very sick people, chronically ill, autoimmune. And, my mom kept telling him, nope, you're going to bring your message to the world. It's not going to be just one-on-one. And that's where Pompa program was birthed. And so now we're reaching thousands, millions of people now with this information. And honestly, I wanted to follow in his footsteps. I saw the difference that he was making, but I wanted to go to chiropractic school because the philosophy is if you can identify what the interference is and remove it, the body is designed to heal. Yeah. So that's where we're at.
That's crazy. I didn't know that. The chiropractic care has changed my life as well.
Yeah.
Here's a fun one for you. I was 19. I was pushing 400 pounds and I had gotten a career job right out of high school, and C2 and C3 had almost completely fused.
Wow. At such a young age. Yeah.
Almost fused. I am at my desk and I was working in a call center. And I knew all of our scripts by heart, all of it, right? I had been doing it for a while, and I was so used to typing on my keyboard and dealing with credit card numbers, and I could do it with my eyes closed.
Right.
And all of a sudden, I'm sitting there, and I'm sending the signal, and things aren't working.
Wow.
And I walk up and I couldn't speak. I walk up and I write a note to my boss, and she loses it. And she wouldn't drive on highways.
Wow.
Drives me to the hospital. The Western medicine doctor, comes back and the pressure must have alleviated. He's like, oh, it's a weird migraine. He ran $14,000 worth of tests in an hour.
And he came back with migraine?
Migraine.
Wow. Interesting.
I went to see a local chiropractor 2 or 3 days later. He did a single x-ray.
Yeah.
And he's like, oh yeah, C2 and C3, they're almost fused. spent like 6 weeks with him. That was it.
Yeah. So was it corrective care? So they just, did it heal over time?
Yeah.
Okay.
Yeah. Everything's good. Tip top.
Yeah. So I'm, by trade, I'm a chiropractor. I went to school because I wanted to be a doctor, right, of holistic medicine. But it's so funny. I always tell the story because I went to school graduated with 300 people, and they all thought I was crazy that day one of orientation I was there and saying, I'm not actually here to be a chiropractor.
They were probably funny. So confused. They're like, what?
But what I value, and I don't say that to, demean any chiropractor. I love chiropractic because I believe in the philosophy. Really, truly, chiropractic care is removing a physical interference with manipulation.
Yeah.
Right? That's what the cracking and popping, for those of you that are listening, that's what it is.
Right.
But manipulating those joints actually helps to remove interference on the nervous system, which helps in turn restore that pathway, right, in the healing body, right? Always going back to it. Now, what you and I focus more on is the chemical side, right? The chemical interference, and my deeper passion is the emotional, the chemical, physical, emotional, right? My true passion is the emotional healing side, but what my father and I are teaching today is more the chemical. What toxins are we being inundated with today that's affecting the healing body?
So we'll get to some of that. But to your point of emotional, as I was looking into you lost your mom. That had to have been a pretty big turning point in life.
Yeah.
How did losing her reshape your understanding around health and healing?
Whoa, this is a loaded question. I'm so happy you asked. When I was 7 years old, I actually lost both my parents. My father, it was a murder-suicide. My father murdered my mom in front of my brother and I, and then killed himself. And weeks later, I was put in the Pompa home. So I'm actually Dr. Pompa's adopted daughter, not biological. That's why my hair is blonde. No, I'm kidding. My mother now, she actually is blonde. She's related to my biological mother. But whoa, I mean, it started at a young age when I was, and forgive me, listeners, your opinion on vaccines, I don't know, but let's just dive into it. That's okay. I remember, about when I was 6.5, my parents passed away, when I was 7. My twin brother and I, we received our last rounds of vaccines.
Okay.
And I remember going home and my brother's face changed. Just everything about him changed. And he was overly vaccinated. He was vaccine damaged from that moment forward. And he was held back in school. He was put on the spectrum. And I remember all of it. I believe God allowed me to remember that moment.
Yeah.
And so at a very young age, I knew that we were given toxins essentially that changed everything for him. And I wasn't affected in that manner, but most boys, especially in twins, are more affected by vaccine damage than girls are. My health issues came a lot later in life when I started to have hormone changes and puberty and all of those things. But within 2 years, so 6 months after my brother had been put on the spectrum, held back in school, completely changed his life. For 2 twins, for one of them to be held back and the other to move forward, you can imagine how that affected his ability to grow up, right? But within 6 months of being taken in by the Pompas, my father, what he knew about the cell membrane and detox, and that word is overly used. We can get more into what detox truly is, but and also just about a child's brain, right? My father was a chiropractor. Within 2 years, Dylan was released into a normal school system just by changing his diet, by a small amount of detox. He was a child, so we couldn't push that too hard without him being majorly symptomatic. And then chiropractic care was part of it.
A kid can't really deal with.
No. And so at a very young age, I saw the power of the healing body. I saw it in Dylan. I saw it in myself later on as well. I had my own healing journey. But yes, it all started with ultimately where I sit today. I had to go through something hard. My family's motto is from pain to purpose to promise. And so even though I lost my parents, so my brother was put on the spectrum and I had my own healing journey. And a lot of people listening may think that they've lost all hope. But once you get through that and you find your answer, you truly have a purpose in teaching other people your story.
Absolutely. Did you notice the shift in his face back as things changed, or was that
it was more so like a it was more so like an emotional change. He was Asperger's. So like he was instantly very angry. He couldn't handle sounds. He was extremely sound sensitive. But I remember coming home from the doctor and just kind of this look on his face, like something wasn't right.
Mm-hmm.
Right. But yes, no, you would meet my brother today and think he's completely normal. He's just a little quieter. I'm complete opposite. I'm extroverted, right? You would think he's just quiet, but no, he's not technically on the spectrum. I guess most of us are on the spectrum in some way or manner. And hey, it's a good thing for those of you listening.
Yeah.
But yeah.
That's very interesting. In the depths of all that, what was like a thread of hope? Was it kind of what you saw in your brother? Like as far as like navigating like losing your parents at such a young age and then getting transitioned into, I mean, that had to have been probably a very different family dynamic for you than what you were used to up until that point.
Yeah. I mean, especially for, I mean, I was young. I mean, but I remember my parents and I remembered my lifestyle prior. We didn't eat healthy. There was no health aspect to my life. And so to all of a sudden, be put into this family, which was the Pompas. I mean, the Pompas where everything was organic, everything was non-toxic. There was this lifestyle that they lived that all of a sudden, I wasn't allowed to eat Halloween candy. There was none of that anymore. Right. But praise God.
That had to have been a fight.
Yeah, right. I mean, thank God, right? I mean, now what I know is because of what my parents have taught me and what I grew up in. So it was a transition. But I have to admit, I have to give a lot of credit to my parents. They did a great job in instilling that even though difficulty happened, it was, Romans 8:28, all things will work together for good. And so at a young age, I clung to that. And I believe I was blessed to heal from something that was very painful, but ultimately, and I won't lie, I'm not sitting here today saying that I still am not in counseling, still not working on myself and the trauma that you've been through, right?
Mm-hmm.
But ultimately, it's put me in the place that I am now to be able to influence other people. So, from pain to purpose to promise, that's what we like to say.
I love it.
Yeah,
love it. Growing up as Dr. Pompa's daughter,
yes,
in the functional medicine world,
yes,
what was one of the most pivotal moments that transformed health into, from a family profession to something that you really wanted to dive into yourself?
I love
made
that.
It a personal journey.
I love that question. And I truly am the only Pompa. There's 5 of us that decided to go to chiropractic school, that wanted to be a doctor, that loved the clinical side. I love working one-on-one with clients. I'm the only one. The rest of them are all business. Thank God, because we wouldn't be sitting where we are influencing the amount of people, right?
Without
which is the mission, right?
Thing,
the mission is, you're on the same mission. It's the MAHA mission. It's Make America Healthy Again, right? It's teaching people how to empower themselves to get well, right?
Yeah.
But I'm the only one that wanted to actually, teach it, right? Like my father. But thank God for the rest of my brothers that took the business side. But truly, it began with seeing Dylan get well, like my passion for it. And then when I went through my own healing journey, in high school, I hit my head in a car accident. And what we like to call, my father and I, we like to call the perfect storm happened in my life, where 3 stressors came together at once.
Yep.
And it put my body in fight or flight.
Yep.
We call it cell danger response, right? And just things weren't right. I hit my head. I had massive heavy metal exposure from my mom in the womb. So my mother, my biological mother, she was a dental assistant. So she, years mixing amalgam fillings in the office. And if you don't know amalgam fillings, so silver teeth in your mouth, they're made up of 51% mercury. And if you know, mercury goes right to the brain. It's a neurotoxin. The body hides it in the brain, and it affects the way your brain can function.
This is so funny. Dr. Shade was just on the podcast. That episode dropped this week. Who owns Quicksilver and created Quicksilver Scientific.
I know. Yep.
Yeah. Interesting that you're saying this.
You guys probably talked about mercury.
Oh, yeah.
Yeah. Yeah. So what we know is that, a lot of mercury can be passed from mother to baby in the womb.
Makes sense.
Especially if mother has mouthful of amalgams. And some of the sickest clients I've ever worked with, if you'd believe this, are dentists. because in school they just drill in, out mercury fillings. That's what they did, right? Some of my sickest clients have been in dental offices. And so my mother, she also received a couple Rogam shots as well, which is one of the highest vaccines in mercury. And then of course I was highly vaccinated as a child as well. And so my mercury load was through the roof. So heavy metals, extreme emotional trauma, as you can imagine, living in a home that, I was adopted. In my mind, I was an orphan, right? Even though I was still healing from it, I was an orphan. Mm-hmm. And then I hit my head just having a physical trauma. And it wasn't even a crazy car accident, but it was enough that my body was like, nope, your bucket is full. Now you need to go figure out what's next. You need to get help, essentially. My body was screaming for answers, ultimately. And I started diving in. I asked my dad, what do I need to do? He said, and most of us kids didn't want dad to tell us what to do, right? But I was the first to say, how do I change my diet? Mm-hmm. What do I need to do to detox? And so I just started doing everything my dad told me to do. Mm-hmm. And it worked. Yeah. I started with changing my diet and my acne improved. I had horrible hormonal acne. I had horrible painful periods. I mean, you name it. I had horrible fibromyalgia where my knees would hurt. My dad, when I was young, and I think it was connected to losing my parents, but I had horrible leg pain as a child. And my dad would have to rub my legs at night for me to fall asleep. And my leg pain got worse. And so when I changed my diet, started detoxing and doing everything my father taught me, I just got better every step of the way. Every year I got healthier. I got in better shape. And most kids in college were taking Adderall, Ritalin, Vyvanse to study. Mm-hmm. I was doing brain phases, which is our detox that helps get the mercury out of the brain. Mm-hmm. And I just felt so on fire when I would do these brain phases that, not even kidding, I would plan my midterm and final exams around detox because I felt so good. It was crazy. So my love for, what we're doing now, it really did come from my own journey in it. So, yeah.
Fascinating. Your father's own health struggles were likely a close-up view of the limitations of traditional medicine. What specific experiences made you realize that true healing goes beyond conventional treatments?
Yeah, I mean, I think there's a time and a place for it. I've had my appendix taken out. Yeah. And I remember the day, I never thought I'd go to the hospital. I mean, we didn't grow up going to the hospital. No. Right? I remember my brother slit his hand open. It was like, I don't know, he was skateboarding or biking or something. We were very adventurous kids when we were little. And my dad stitched it up. We didn't go to the hospital. There was none of that, right? And I remember the first time I had to go to the hospital because I had really bad appendicitis and my dad wasn't home to adjust me because usually he would just adjust me and hope, that we could, fix it before needing to go to the hospital. Sure. There is certain chiropractic adjustments that you can manipulate. It's pretty painful, but you can get someone out of acute appendicitis with chiropractic care. Always find the right person, someone that's qualified to do it. But anyway, my father wasn't there. So he was like, Olivia, you have to go to the hospital. Mm-hmm. And I remember walking into the hospital and the nurse was like, well, you're going to need pain meds because you're going to be here for a while. And I was in excruciating pain. I was like, I don't want to take any of that. I've never been on an antibiotic. I don't want that either. She's like, well, you're going to have to. And so I eventually did because my surgery wasn't until 7 a.m. So there's a time and a place.
Yep.
But
I degloved this pinky.
Oh, did you? Yeah.
Motorcycle accident.
Time and a place.
First time I've been in a hospital in like a decade. So
yeah.
I
yeah.
Get
I
it.
just am so passionate about I know the body can do it. I really do believe. I believe God designed our bodies uniquely, but perfectly in the ability to heal. We just, unfortunately, we live in a world today that has changed so much. It is so loaded with toxins, chemical, physical, emotional, that our bodies are loaded with inflammation. Therefore, we can't heal properly. So that's really, truly where my passion lies, though, is teaching people how to harness that innate ability to heal. Yeah.
Amazing. You've navigated chronic health challenges that most people never see.
Yeah.
What was the lowest point in your health journey, and how did that experience crack open an understanding of true wellness?
Yeah. Okay. I love this question because obviously I had a step journey, meaning I had to go through the car accident, figuring out that I was in a moldy home. There was multiple things that I kind of figured out, okay, this is a root cause to why I didn't feel well. But I had 2 situations that I'd like to share. And, the 3 that are most commonly missed today in practitioners' offices is, like I said, mold, heavy metals, and pathogens. And when this might resonate actually with a lot of your listeners, so that's why I'm going to tell this too. When I was 21, 22, I was in undergrad. I was getting my pre-med at Florida State. And I started to have my wisdom teeth come in, right? And naturally, I'm being told by my dentist that I need to get them out. But during that time, this was back when I was 21, 22, my father was starting to learn about cavitations. Are you aware of cavitations? No?
No.
Cavitation is a hidden infection of the jaw, essentially. So.
Oh, yep.
Yeah. So you've heard of the danger of root canals, or, why people today are afraid to pull wisdom teeth, right? Well, the reason why is because these hidden infections or cavitations can be deep in the jawbone, right? And unfortunately, it affects the immune system so much. It compromises the immune system so much that it's driving all of these other issues, right? It's allowing pathogens like parasites to never be, we can't fight them, right? Lyme disease is going rampant because it can store in these places. It can hide in these places. And so my father was starting to learn about these things. And so he told me, nope, don't listen to your dentist. You're not getting your wisdom teeth out. Let him just let them come in naturally. I said, okay, Dad. Do everything my father told me to do.
Yeah.
So I go 3-4 years all through my early 20s with these wisdom teeth coming in, and they hurt so bad. Like when I tell you every 6 weeks, they would start to push through and they were so impacted, right? If you think about it, our mouths are shrinking because of braces, because we're, our jaws are in general changing because our diet over the course of 100, 200 years has shifted. It's changed, right? And so, wisdom teeth are coming in, and I started to experience severe dysbiosis in my gut, and then yeast infections. So women listening, yeast infections, it's a dysbiosis of the vaginal canal, literally.
Yep. Yeah.
And so I started, every 6 weeks, my breath would just stink. I've never had bad breath, right? And my diet was dialed in. I, did fasting. I did it all, right? Detox. I never had bad breath. All of a sudden, I started having bad breath. And I go, okay, well, if there's a dysbiosis in my mouth, there could be a dysbiosis in my gut and therefore other areas of my body.
Yep.
And so I started to put it together. It's my wisdom teeth that's causing my yeast infections.
Yep.
And for most women, it could be a UTI. It could be other vaginal issues, whatever it may be, even gut problems. SIBO. SIBO can be a pathogen issue in the mouth.
That's one thing I come across like a lot. Like correlating the two. It's like,
absolutely.
Oh, like how long has your gut? Oh, like when did those issues start?
Right. Yeah.
Yep.
So, and it's crazy because, 7 out of 10 chronic illnesses, a lot of them can actually stem from the mouth. So fast forward, this perfect timing. My father met my current dentist, our program dentist. His name is Dr. Scott Chandler. He's out in Park City, Utah. He is the most exceptional dentist on the face of this planet, I'm telling you. But interestingly enough, he brought me in for a full CBCT scan, which is a 3D x-ray of the jaw, right? Okay. Where you can actually see the density of bone and tissue in your jaw. So if you have a big fat cavitation from a wisdom tooth being pulled, right, and you have all this dead tissue that doesn't heal properly, pathogens can hide in here, right? And he goes, Olivia, your wisdom teeth are coming in so infected, and because they were so impacted, he said, you unfortunately do have to get them pulled out. But what's great about these biological dentists that are doing wisdom tooth removal properly is that they fill that tissue. They make sure that tissue grows back with stem cells, PRF, laser. They kill all of the pathogens in there. So there's ways to do it. Cadaver bone is another way that they're doing this as well. So they're filling that cavity so that pathogens can't grow in there. And so that changed my life. I never had another yeast infection ever since. And a lot of my other health issues, a lot of my hormonal issues, I had painful periods, went away, just vanished. So it was like the ability for that interference to be taken away and for my body to respond so quickly to that was a first part of that. And then I would say my second part that I really want to share is biotoxins. So when I was in chiropractic school, so about 4 or 5 years later after grad school, after having my cavitations removed, I was, the healthiest I've ever been. I mean, that was a great 4 years. I'm telling you that right now. And, I lost like 15 pounds, that extra like inflammation weight just went away. And then that's when I went to chiropractic school, and there was a lot of mold in the building, a lot. But not only that, but I was living in a moldy apartment, but I didn't know. It was under my washer and dryer, hidden. I had no clue. And I'm Dr. Pompa's daughter. I know a lot about mold. Even I didn't know it was there. Okay. And so, I went from being super healthy to having absolute severe urticaria. Urticaria is hives all over your body. I mean, my eyes would blow up the size of golf balls, and I was so itchy all the time, just itchy, so uncomfortable in my own skin. And everyone would go, it's the pollen in Atlanta. Because I lived in Atlanta at the time.
Okay.
It's the pollen.
It's the pollen. Yeah. Okay.
It wasn't the pollen. And I refused to take over-the-counter medication. Like, I wasn't going to take a Zyrtec, none of that, right? Yeah. It was mold in my home. It was mold that was literally compromising my immune system and making me hyperactive and hypersensitive to dust, dander. I became allergic to my dog. I'd never been allergic to animals in my life. My body was screaming for help. And I found out it was mold in my apartment. And so for 4 or 5 years after, I was extremely sensitive to mold. Unfortunately, I'm at a place now where I'm not as sensitive. But a lot of people that have had mold exposures and come out of them, their body stays hypersensitive even still, right? So anyway, but those are the two situations that unfortunately, even as Dr. Pompa's daughter, I too had to experience in order to learn, in order to now teach what's ultimately really keeping people from getting well. Those are two examples of what we call a root cause to chronic illness: pathogens, biotoxins, and heavy metals. Those are the 3 commonly missed ones.
Yeah. Functional medicine is about root cause resolution.
Yes.
What has that personal battle taught you most about identifying and healing the deepest sources of these health issues? Yeah,
so I love that question as well. So in our process, we take a questionnaire. We actually really, my father and I were really passionate about teaching testing is so valuable if it helps you get to cause.
Yes.
Right? There's so many tests out there. They can run thousands of dollars of all this blood work, but it doesn't tell you that mold's in your home. It doesn't tell you that you've got cavitation in your jaw that's making you sick, or that you have a root canal that's driving your cancer. Seriously, right? It doesn't tell you, ultimately the root cause of why you're so sick. And wait, what was the question again? Sorry.
Functional medicine is about root cause resolution.
Yeah.
What has your personal battle taught you about
this is
identifying, healing, and deepest sources of health?
Yeah. So love testing, but actually the first thing I do with my clients is I have them take a history, very deep history, a questionnaire. We call it our neurotoxic questionnaire. And we're asking them the strangest questions. Seriously, people are like, why do you even care about this? Right? Have you ever lived next to an airport? Have you, what were your occupations? Like, what have you worked in? Have you ever, for example, dentists, were you ever working in a dental office? Mercury exposure, right? Have you ever lived next to a cell tower, right? Massive EMF exposure, right? So we're asking them questions like, have you ever had a wisdom tooth pulled, or you had a teeth pulled because of possible cavitation? Have you ever had a root canal? What's your vaccine history look like? What did your mother do for a living? What did your parents do for a living? Do you know how many farmers, how many people I've worked with that they're like, oh yeah, my dad was a farmer. He used to come home with pesticide residue and Roundup all over his clothes. Oh, by the way, my father passed away with cancer. So we ask all these strange questions, but help us get to the root cause of why these people are so bucket filled with toxins, right? So we start there. But ultimately, I had to do the same in my own journey, right? Is analyze kind of my history. What was I being exposed to that I could then go and remove and allow my body to heal? We do the same with our clients. So we actually start with an NTQ.
I start with, not to the depth of yours, but I agree.
Yeah.
Like, I think at my current level of knowledge, one thing that I pride myself in is the ability to take subjective data and match it to like the lab work and be like, okay,
Yeah.
like what I thought of the other day is like kind of creating your fingerprint.
Mhm.
Like, okay, what does your subjective data tell me with this piece of lab work to create like your unique fingerprint of like what's going, like what are we dealing with? What's causing these things? What's going on? So that doesn't surprise me and makes a lot of sense.
Yeah. And sometimes it's so hard too, and I'm sure you resonate with this too. It's like I could look at someone's history and they've been exposed to so many different toxins, but their blood work looks normal, but they don't feel well.
Yep.
Right? It's like, how many times have I had clients that go through our program that they're like, the doctor sent me home because my blood work looks normal, but I don't feel well. And that's why I'm searching for answers, right?
Yep.
I've seen that time and time again. And a lot of the time it's because, you know, unfortunately, the conventional medical world isn't looking at, number one, the right testing, right, that gets to cause. But yeah. We need to be asking the right questions. And so root cause is truly how we do that. Yeah.
Absolutely. If you could go back and speak to yourself at those, you kind of touch on a couple, right? Back in college.
Yeah.
The car accident.
Mm-hmm.
These, broken moments. What truth would you share and what wisdom would you have gained that you wish you could have known then?
Yeah. Trust the process. Whoever your coach is, trust your coach. And it doesn't happen overnight. It took me years, and I was young when I figured out this information, thank God, right? Most people don't have what I have, which was a blessing to have Dr. Pompa as a father, right? Most people don't have that.
No.
So people, they start getting symptoms, unfortunately today, as early as childhood, because that's the world we're living in. And by the time they're 20, they're on their deathbed. Seriously, right? My sister-in-law, she lived on her deathbed all through her teenage years. That's the world we're living in. But it's like you've got other generations that they started to have symptoms in their 40s, their 50s, but it took them years to get sick. It's going to take them years to get well, right? Maybe by changing their diet, they could see some massive symptom relief. Maybe by certain therapies, they could have a lot of relief where they go, oh, my life, I got my life back, right? But unfortunately, but fortunately, the real things that work, they take time to allow the body to heal.
Yeah.
And so I think that's what I probably would have told myself. And I would be telling your listeners as well, if you're on this healing journey, to be patient, trust your coach, trust the process, and that true healing, it takes years. True detox takes years. Getting the actual heavy metals out of the brain, which is what my father specializes in teaching, is how to use true chelators and real binders and the real cell detox. I almost hate the word detox because it's like, oh, I'll just do a juice cleanse. That doesn't work. That is extreme. I'll just sauna. No, that's the most superficial detox on the planet, right? Mm-hmm. Does some of these things open up detox pathways? Yes. But in very sick people, does it help them? No, it makes them more sick.
Yeah.
Right? You've heard of herxing, right? In sick people, those things don't work. But those are the people that I'm, if you're listening, you're like, I'll never get healthy because I'm so sick. I have 4 autoimmune diseases. Just know that it just takes years, not months. It's what it is. So,
well, I think to your point, like you brought up, your sister-in-law, I believe you said, through her teen years, so many people have been neglected. And over the years, like I've met people or had conversations because of social media, and they're like, oh yeah, I've had this gut issue since such and such, and like they just like they've accepted it. Yeah. Like they don't, there's no hope of any change. And they're just like, I live in this disease state. These are the medications that like,
but other people have it, so it must be normal.
Yep.
Right? You're so right. That was me in college. Like I used to look around the room and my friends would be, taking medications every day because they had a headache. But, my mom had it. It was in my family history. So it's just normal. Right? But it's not. Like how horrible to allow these things to become part of our identity, that these symptoms are normal. No, they're not. Yeah. So I think that's the first thing. You
actually just reminded me of a client that I worked with at one point. years ago. And her family unit was very tight from a perspective of like grandma, mom, and her were all just very, very close knit.
Yeah.
All of them had to take like extremely high doses of mag citrate to go to the bathroom.
Yeah. Not normal.
And they were like, oh, it's normal. It's just my genetics. Like,
gut motility is slow because of a lot of other things, actually.
Yep. I was like, interesting. Okay.
Yeah. It's so true, right? I mean, just going back to these kids today that, are having eczema and psoriasis at such a young age. Well, that's a gut problem. Partially, it's also a toxin problem. And, unfortunately, we are putting kids on medications at such a young age. We're seeing gut problems show up in kids, IBS even, at such young ages. And it all starts, I'll be honest, it starts with mother's toxicity in the womb. Not to blame you mothers, but it is what it is, right? I'm not a mother yet.
And
I
you
will
don't know
be
what
one
you don't
day.
know. You, to be fair, like you don't know what you don't know.
No, exactly. No. But, it even starts with the birth canal, right? How many more C-sections are we doing today? And not, the babies aren't passing naturally through the birth canal, which is literally the first dose essentially of microbiome that the baby has is going through the vaginal birth canal, right? And so natural births aren't as common as they were hundreds of years ago, right? And so we could even start there. But there's just, our world has shifted and changed so much in a way that doesn't benefit the baby's health and the microbiome health, right? What about kids, mothers being afraid that their kids are going to go get dirty outside? Or that, they're spraying their kids' hands with hand sanitizer. COVID-19, everyone's washing their hands 24/7 and putting hand sanitizer all over their hands when our hands have a microbiome, right? We were meant to eat with our hands and actually allow that microbiome into our bodies. It's crazy what we've shifted. And, moms don't want their kids to play outside or play with other kids for fear that their kids are going to get sick. Their kids should get sick. It builds their immune system. And so it's this whole paradigm that's shifted that's allowing or not allowing, this diversity of the microbiome to actually flourish. And therefore, kids are now getting these brain disorders. Our gut is our second brain. And so we're seeing in children, we're seeing these brain disorders and these gut disorders happen at such young ages. We wonder why.
That's just, you made me think of someone that I know that's like wicked, like germaphobe.
Yeah.
And like what this person thinks that they're doing to protect their kid is actually harming it.
I know. Yeah.
Right? Like,
what you don't know, but that's why we're here today.
Wild. Your work isn't just professional. It's deeply personal.
Yeah.
Describe the moment that you were able to take your experiences, right? Everything that you've been through, all the way, dating back to like the loss of your parents to today, to drive into the mission, helping, heal others and just really come alongside your dad and be that person in the company that is the clinician in helping people.
Yeah. I don't know. There's so many things. Like I have to say it was the loss of my parents, because my parents always said that God doesn't waste pain like that. And I knew that in my heart that I had gone through something spiritually painful, but spiritually divine, that I knew I was called to something very large. At least that's what my parents told me my whole life, right? Mm-hmm. They indoctrinated me with that belief that God was going to use my story to reach people that were also hurting. And I believe that in my heart. I believe that. I believe that God doesn't waste our pain. And then of course, also my own healing journey added to just my passion. Yeah. And I think also going through chiropractic school really really helped me understand my passion as well. And I'm going to tell you why. Well, I love chiropractic. Again, I'm not going to beat down chiropractors in any way, but it's just physical interference, right? It's and my father would speak to this as well, where he would have sick people coming into his office Lay face down, let me adjust you. They'd walk out and they'd have some symptom relief because there was physical interference, but these people needed more. They needed to change their diet. They needed to get out of the moldy home that they were in. They needed to detox their bodies of these heavy metals that they've been exposed to since before they were even born, right? They were so sick that chiropractic care wasn't enough for them. And unfortunately, in school, I kind of had to go through that where I was seeing these chiropractors just passionate about one thing, and it was just adjusting. And that's okay. Brick and mortar practices help a lot of people, but I knew that I stood out from that. Yeah. I knew that I had more to teach than just manipulate the body and all your symptoms were going to go away, right? Mm-hmm. It's never one thing that gets people sick. When we talk about cause, it's never one thing. No. That's why we talk about the perfect storm. There's typically 3 stressors that come together and make people very ill, right? Whether it be chemical, physical, or emotional, or maybe it's 3 chemical, whatever it may be. Yeah. But it's also never one thing that gets people well. It's never just diet, right? It's never just detox. It's never just therapy, but you have to do all of it. So I really, my true passion for what we do, it was me seeing that in chiropractic school. It was the missing link, what some of these doctors were missing, right?
It's just narrow.
Yeah. But you can't do it all, can we?
No.
Right? Like I can't be the dentist that's removing cavitations. Nor do I want to be. It's kind of funny. If I didn't go to chiropractic school, I was going to go to dental school to actually do that work. But thank God I didn't. But
that's really funny because I was accepted to the University of Nebraska for pre-dental.
That's funny. Yeah. What did you go to school for?
I didn't.
Good. Yeah. You're talking to the perfect person. I'm the one that went to school. Forgive me for anyone that disagrees, but my personal belief is that, we really shouldn't be sending kids to school. We should be putting them in rooms with people, mentors, where they can really learn their true passions and to learn from people that are doing it very well. And that's what I'll be doing with my kids when I have kids one day. But unless you want to be an attorney or you want to be a doctor, go to school. Yeah. That's what my dad always said. That's why I'm the only Pompa that went to school. Only one.
Yeah. Well, it's my grandma said this to me like Thanksgiving of the year before this most recent year. And she's like, she could tell I was struggling. And she's like, well, Garrett, like, you're so smart. Like, why don't you go back to school and be a doctor?
You could.
And like, it's funny to your point. And like what you even just said is like, I have colleagues right now in the health and fitness, like coaching space that like own and operate businesses that were full blown like pharmacists, went, did the whole thing, became pharmacists, practiced for a couple of years. Mm-hmm. And then like woke up one day and was like, this ain't it.
Yeah.
Like,
I know.
This ain't it.
Yeah. It's not. We have in our company now, I do one-on-one health consulting, but I also direct our coaching team. And we have a coaching team of about 150 health coaches that we train them in this process of detox, diet change, multi-therapeutic approach, source removal, right? And 150. Oh crap, what was I going to say? I keep like forgetting what I'm going to say. I keep going on this rant and then forgetting. But yeah, 150 coaches that are just changing lives. So it's really cool to see.
Amazing. How has everything that you've been through, right? From loss of your parents, the head injury, the wisdom teeth, all of these things reshaped your definition of what it means to truly be healthy?
Well, even then, like I look at myself today and I believe I'm very healthy compared to the average American. Mm-hmm. But all of those things that I have been through has made me more aware of how toxic our world is.
Yeah.
And that the healing journey or source removal or detox will never stop. I could never stop. I still have to put my foot forward and do these things every day because we live in a sick world. And if all of a sudden I got my health back and then just said, well, that's it, right? I'm healthy now, right? And I stopped my detox process. I stopped my diet variation principles and changing my diet and focusing on rediversifying my microbiome with fasting and doing everything that I do to maintain and optimize my health. I believe I'd go backwards, right? Because of the world we live in. So I would say that's definitely something I've learned, just everything that I have gone through, but also going back and watching my body obviously heal from them. It's helped me realize that the world that we live in is so toxic and that you have to be careful. You have to live a conscious lifestyle. And you can only achieve that through education, ultimately. And that's where coaching comes in. I think health coaches are the new doctors. I really do believe that.
Yeah. I think we're going to see a massive shift in the next 20 years.
Yeah,
it's already
next 4
happening.
years.
It's already happening. But
the next 4 years is going to be really big. In fact, I believe the real change isn't going to come from doctors teaching. I think it's going to come from the mothers in the home, mothers listening to this podcast right now. Because it's usually the moms at home that care most. Not that the men don't care, but the men are the providers. They're out, making the actual money to put the food on the table. Not that women don't do that, but typically in a family home, that's what's happening. Yeah. But the mothers are at home learning about, hey, how can I fix my kid's gut problem? What do I need to do in order to change their diet? They're usually the ones out there, going to the health food market and asking questions in the, in the whole body section at Whole Foods, right? What's good for heartburn, right? It's usually the moms. I believe if we can teach the moms how to, help their kids, I think that's ultimately where we're going to make America healthy again. Seriously, it's going to be through the moms. I believe that. The women at home.
So this is a call to action to all those women out there.
Yes.
Hire a coach.
Yes, hire a coach.
You deserve that's one thing I'm really passionate about. Women, you deserve to put yourself first. You deserve to be healthy because guess what? Like I've had the honor of doing it in my business over and over and over again. And it has a trickle down effect.
Yeah.
If you're healthy, if you're pouring from a full cup.
So true.
Everyone else around you gets healthy.
It's right. And a lot of the times it's the moms that are saying no to doing coaching because they're like, I'm too busy taking the kids to school, or they're not putting themselves first, to your point.
Or they're not worthy.
Right. They don't. Because mothers are the givers ultimately, right? And we see that. I see that clients all the time. They'll be like, well, I don't have time to start my diet change because I, have too much going on. I'm taking care of all of these people in my family. But if they could focus on themselves for a moment and get themselves well, how much more would their help in the home be, achievable or exponential to your point. Yeah. So
in a world that often treats symptoms, you're committed to healing the whole person. What's the most profound lesson that you've learned about health that has nothing to do with medical tests or treatments?
Yeah. I would say if your body's screaming for help, yeast infection is an example that I gave earlier. I had severe yeast infections, and most people are like cringing hearing me say that, but I don't care. It is what it is. I had severe yeast infections and it sucked, right? But most people would be treating the symptom with suppositories or getting on birth control or, just, treat the candida problem, right? Take herbals that kill candida. But I knew better. I knew that there was a root cause that was driving inflammation and allowing pathogens to overgrow. Candida is an opportunistic pathogen, meaning when the immune system is compromised, these things overgrow. Candida is actually natural in the body, just like parasites are. It's natural to have certain levels of candida and parasites in the body. But when the immune system is compromised by, say, cavitation or heavy metals or mycotoxins, mold, your immune system can't handle it. So these things take over. It's an opportunistic pathogen. So, definitely one of the things I've learned is if your body is screaming for help, don't treat the symptom. Don't just treat the symptom, but look upstream. Look for the root cause of what is disrupting your body's ability to just fix it on its own, if that makes sense.
Absolutely. Everyone on the show gets asked, it's the intentional health for women. So what does living intentionally look like for you stepping into this next season of your life?
Okay. Living intentionally. Okay. So I am definitely how I live my life is very intentional in terms of being very conscious about what I put on my body, in my body. I am literally the health Nazi. I know way too much about food. I know too much about toxins. Like,
Yeah.
I'm the person that gets in an Uber and like sniffs first because I'm not getting in if there's air freshener. Okay. That's like how I live my life. But I have to say, living intentionally, for a lot of people, they get to this place where, and you know, you're on Instagram, you're scrolling through, people will make fun of my dad because they're like, well, your dad's a fearmonger, right? Because all he does is expose, all the toxins in our life. But, meanwhile, he actually gives the alternative always. My father always says, hey, avoid this, use this instead, right? But unfortunately, people look at the way I live my life and they go, she doesn't live her life. She's just miserable, avoiding toxins all the time. And I have to admit that's not true because it's my lifestyle and it's normal for me and I'm very proud of it.
Yeah.
But I have to admit, for someone new going on this journey, right, and wanting to live more intentionally in terms of like living a more non-toxic and pro-healing lifestyle, have grace on yourself. In the past 2 years, I've had more grace on myself because I've realized that this constant like avoidance of everything doesn't help. If anything, it just gives me anxiety sometimes, right? But have grace on yourself. This is a journey. Women still do some of those things that make you happy, that give you joy. For me, it's getting my nails done. I definitely do things to avoid, soaking my fingers in acetone, right? I have them saw the stuff off instead of soaking it in acetone. And I do the little things to avoid the toxin exposures, but I'm not going to be that girl that's like, I can't go get my nails done because it's toxic, right? So, and the other thing too, is it's like, and this is really where education comes in, is being able to live intentionally while living, a non-toxic lifestyle, but also still having fun. Like, I love to eat out. I'm a total foodie, but I will tell the waiter, hey, I'm allergic to vegetable oil. I'm allergic to canola oil. I'm allergic to seed oils. Could you please cook my steak in butter instead? Right? So it's like, I'm not just not eating out. Most people would go, well, eating out is bad for you. No, it's not.
Yeah.
Right? No, it's not. Pick the places that maybe you're sourcing better ingredients, or, maybe pick the place that can, sub your steak for canola oil and butter is better, right? Or real olive oil, pure olive oil. But, yeah, I would say for me, it's still enjoying life, right? If you're early on this non-toxic healing journey, have grace on yourself, but also, just keep educating yourself, because that's ultimately how you maneuver around all of these things that, there's so many controversial discussions out there today about whether or not seed oils are bad, or, just everything, right? Everything's controversial, but ultimately it's education that helps you kind of maneuver around those things. But that's how I'm living intentionally this year, is trying not to be so strict about every little thing, because unfortunately we do live in a toxic world. So I think just being aware of the things that make me happy, the 80-20 rule, as I like to say, is important. So.
It's funny that you say that the way you said it. There's been, I don't know if you've seen it, there's been like a Instagram reel like going viral. And it's like this girl standing at like TJ Maxx, and she's like grabbing a candle and then like putting it back on the shelf. And she's like, I wish I could just go back to living life
way that before she knew.
Before she knew.
I know. It's so true, because you get all these people that like do everything wrong, but they have no health problems, right? But, I think there's many reasons for that. I believe that their bucket just hasn't overfilled, unfortunately, but I believe that at some point it will. That's sad to say, but it's true. So we do need to be practicing a non-toxic lifestyle in every possible way. But to your point, I think that there's definitely, like, for me, I love candles, but I just buy tallow ones. Tallow that are made with essential oils, right? There's just better options. So
Where can we find you?
Okay. Well, social media, Dr. Olivia Pompa. My father's Dr. Pompa on social media. And I'm mostly on Instagram. That's my favorite platform for sure. I am starting a new YouTube series very soon. I want to start to walk people through my healing journey. I want to start to tell my full story from when I lost my parents, when I entered this new home with knew people, what it was like, and ultimately this healing journey that I have had to go on, because a lot of us have had emotional trauma in our childhood or in our lives at any given point. But a lot of it can actually be from our childhood that comes later in life and keeps us from reaching our full potential, whether it be in relationships, whether it be in business, whether it be in anything, really, truly, whatever it is that you're trying to do in your life, but you're not getting there because of false identities that you've created from past childhood trauma, right? I want to help people debunk some of those things. And so that's going to be my YouTube series. It's going to be me teaching people how to do it because I've gone through it, right? So yeah.
Love it. Well, thank you so much for coming on the show.
You're
welcome.
It's been a
pleasure. If this episode brought you value, please subscribe, share with a friend, and leave us a review. We are not normal. We are intentional.